Hello, hello, happy Sunday. Welcome, you guys. I'm Dr. Malea Jensen. I am a board certified family physician. This is my live Q&A. So live Q&A with Dr. J's Prescription for Health. So this is your opportunity to be able to ask questions, medical questions, and to get answers that you might not be able to get from your personal physician. As a reminder, I am a family practice physician, but I am not your family practice physician. This is for information purposes only and does not constitute any medical advice. So with that being said, I will take questions, and we're kind of waiting for YouTube to get going here. So I am live on YouTube and Instagram. And if you have any questions, go ahead and shoot you guys over on Instagram. Let me know if you have any questions. Kind of wait for YouTube to get going. Here's a question on leg cramps. What is causing my leg cramps at night? Well, you know what? That is a good question. But a lot of times, well, one time, I don't even know what diet you're on. If you're, I can only assume that you're having leg cramps because you're on a carnivore diet or a ketogenic diet. And too much salt, a lot of times we like to increase our salt intake as carnivores, or animal-based eaters will increase our salt. And I'm not telling you that you're eating too much. It might be too much for you. A lot of times we don't even need enough salt, and it's the good salt. And I'm not talking about table salt. I'm talking about a good mineral salt like Jacobson's or Baja Gold. Those are my favorite salts. So if you're looking for a good salt, I love Jacobson salt. It's a flaky salt that's crunchy and has great taste. It's made in the United States as well. Baja Gold is another one. B-A-J-A Gold. B-A-J-A. You can get them both on Amazon. But what if we're getting in too much salt? Could leg cramps be from too much salt? And what do I mean by that? Well, a lot of times we turn to magnesium. Let's just do magnesium. That helps. But is that what's going on? Okay. So too much salt, too much sodium can deplete potassium, because the sodium is in the outside of the cell and potassium is supposed to be inside the cell. So if sodium is high outside, it's going to keep potassium inside. So we have less available. That it can be, I don't want to say it's a good thing or a bad thing, but I'm telling you that sodium can deplete potassium. When potassium is depleted, it can change magnesium. If potassium is low, it rides along with magnesium being low. So you could say, oh, I'm just going to take some magnesium in hopes that my potassium will go up, but it might be that you're either over-consuming salt, sodium, or in some cases, not enough. Messing around with salt is kind of a big deal. Kevin says, I have neuropathy on my feet and hands from going through chemo with the past 2.5 years. Is there, hold on, I just lost you. Is there a natural way to deal with the neuropathy? Is it the chemo that's causing the neuropathy? Or could there be electrolyte changes like I just got done talking about? A potassium, a sodium, a magnesium, a calcium. I think getting levels of all of your vitamins and minerals, or the ones I just mentioned at least, to figure out what's going on. Also, looking at your B vitamins. When B vitamins are low or, in a wrong combination, I think it's important that we check the B vitamins. Checking thyroid is important. I mean, what if your chemo has disrupted your thyroid function? You see, when we go to oncology is expecting that your primary care is going to be looking into all of these things, and they may not be, okay? And that's why you need to be on top of it. If you're complaining of a neuropathy, pins and needles, or even cold hands and feet, I would look into things before just completely blaming it on chemo. I'm not saying that it's not your chemo, but I would want, before you start taking anything natural, I would check levels. Get a calcium level, get an RBC magnesium level, get a potassium level, get a B12 folate, get a B1 level, B3 level, get vitamin levels, okay? You might be able to resolve the little, I forgot one. Get an iron level. Get all of your iron studies, okay? Iron, so serum iron, a ferritin, transferrin, TIBC, and an iron saturation. You want to know what your iron is doing, okay? That's very important. That could simply be a cause of your neuropathy. So checking labs, but you need to write them down, okay? You need to take them in and have it done. They're not checking these things. They're not thinking about it. They're just doing their chemo. And your primary care, usually is sitting on the back burner anyway. You don't go in very often, and things are missed. So you got to be in control of your own health care. It's unfortunate, but it is what it is. Yes, I just got done working out. Thank you. I rush and get my workout done, quick shower, and then I'm here with you guys for a couple of hours. So yeah, I hit shoulders and a little bit of biceps this morning, and I had a good workout. I helped a guy in the gym as well. He likes when I help him because he says I've been doing everything wrong. I hate when people say that. The fact that you're in the gym, but yes, you could make improvements. Even me, I wish I had somebody who could watch my form and tell me, hey, could you tweak this or tweak that? And I think you'll get a better feeling. So yeah, I helped a guy in the gym and it was fun. Okay. Julianne, I have scattered nodules in my lungs and only 40% capacity. Let me see here. Make sure everything is okay. Have 40% capacity. I'm taking supplements, tonics, intermittent fasting, exercise almost daily. I'm not getting any relief. Relief of what? What do you suggest? That's kind of an open-ended question, Julianne. I don't know what your diet is. I don't know what the nodules are. Have you had a biopsy? One of the thoughts that first come to my head when I hear nodules and I think iodine. I hear nodules and I think of iodine deficiency. When I hear nodules and think of iron deficiency, I think of thyroid. And we as physicians don't check a complete thyroid, just like we don't check complete iron panel. So a complete thyroid panel would be a TSH, a free T3, a free T4, a TPO, and a TG. I would also get a reverse T3, okay? Checking the full thyroid panel all the time is in our best interest. You're being short-sighted if they're just getting a TSH. It's not telling you enough. Let me see here. Here's a question about hair growth, suggest. Emmy, if you could tell me a little bit more about what you're asking. I don't understand. Okay, that would help me out. Julianne says it was caused by COVID. When you're talking about nodules, are you talking about calcifications? Okay, so depending on what part of the United States you're in, if you're in the United States. I'm in the United States. Where are you guys listening from? What city, what state, what country? Help me out here. Let me know where you're listening from. But I'm going to assume that Julianne is in the United States. And in my neck of the woods, we have calcifications, or I guess we could call them nodules, and they're usually histoplasmosis. Whereas in the desert Southwest, you could get a different infection. I mean, a lot of times we have coccidiomycosis or some different types of infections, and then they wall themselves off in our lung. Now, is it possible that the COVID virus could wall itself off in your lung, cause scarring and calcifications, or what you call nodules? Sure. Okay. I don't know who you're talking to, but we don't have a moderator on YouTube, so as we wait for them to come on, we'll figure out how we can moderate over there on YouTube. But Prima Fox is listening from North Carolina, and Julianne is in St. Louis. So you're probably in similar neck of the woods where I am, and histoplasmosis could be very common in that area. And so it may not be the COVID infection at all. However, the COVID infection, a viral infection, could have lowered your immune system, and then you are more prone to getting other types of, fungal infections, okay? And funguses, bacteria, viruses, parasites, they feed on very similar things. They like to eat sugar, and they love heavy metals. They love iron. Can you get rid of them? If they've scarred and walled off, you may not be able to, Julianne. It might not be, and it's definitely not in your best interest to poke and prod at them. You don't ever want to poke a sleeping bear. A protective mechanism for these kinds of things is to wall themselves off, just like a tumor. So you can think of your nodule or your calcification as walling itself off. So inside that is toxins. And that is, I believe, a protective mechanism. So we don't want to be going and poking a sleeping bear. The original case says, so is COVID essentially prednisone? No, COVID is essentially what is been described as a virus. Okay, but prednisone is a corticosteroid, a medication. So I'm not sure if that's what you meant to ask. T.A. Smith says, regarding histoplasmosis, how do they test for it? It's a chest x-ray, and they can tell usually about the shape and the size of the nodule or the calcification and the area that you were likely exposed. And we could be exposed in our young age and really, never have a problem. And then we find these things incidentally. So you're not even having symptoms. And maybe, just maybe, Julianne had those nodules or had those calcifications in her system much before she had COVID. And the fact that she correlated, I got COVID, got a chest x-ray, saw these things, now she thinks that the COVID caused them. It may not have been, okay? And it would be good to look at a really, really old chest x-ray, see what the possibilities are and correlate that way. But yeah, you might not be able to get rid of that scar tissue. You might be living with that. But you knowing that you have it is very important, okay? That's very important, because the next doctor comes along and says, oh my gosh, you got these calcifications in your lung. Oh yeah, I've had them since 2019 that I know of. I could have had them before that, but for sure I know that they're from 2019 because that's when I had my chest x-ray and that's when they saw them. Okay, thanks, Prima Fox. I appreciate it. Yeah, I'm on at IronLadyDoc, Malea Jensen. Sometimes you have to plug both of them in. Does prednisone lower the immune system? Yes. Prednisone, maybe, that's a good question, because a lot of times we have to use prednisone to decrease inflammation for some sort of a respiratory tract infection, okay? So we use prednisone to decrease inflammation so we can breathe better. In the process, yes, if we use it for a long period of time, or just even maybe longer than 7 days, we could experience a decrease in our immune function. So it's a catch-22. I love these catch-22s. Also, if you're a diabetic, prednisone or any corticosteroid can increase blood sugar. So now you got a runaway diabetic situation, which viruses and bacteria and parasites and all of that love to live on, okay? So we got to be very careful prescribing prednisone, or what I should say is over-prescribing prednisone, over-prescribing antibiotics. We don't prescribe antibiotics for a viral infection. Now, we could have a secondary bacterial infection, and yeah, that you want to check for that, getting a CBC and looking at your neutrophils and your lymphocytes. You can tell a lot by the white blood cell count and the individual white blood cell counts in your blood, which are high, which are low. So just going to the doctor and getting treated blanketly with an antibiotic is not in our best interest, but that is our go-to. We are sick, we want an antibiotic, and doctor, please help me. They don't even ask, they just give you the antibiotic, and they're building up resistance. It's unfortunate. I mean, some docs are likely to question things, but when they want you in and out of their office, they aren't going to question anything. Zali is listening from New Jersey. Thanks for being here. Any experience with inflammation, wondering about how to treat burning fibromyalgia with a cold treatment. So you have fibromyalgia, which is basically a diagnosis of exclusion. There isn't a specific diagnosis that says, oh, you have fibromyalgia. No, they go with symptoms, they go with trigger points. They put all these symptoms into an algorithm, and they say, you know what, we can't find anything else, you have fibromyalgia. You have pain and inflammation. And then we treat that inflammation. Now, I have had people tell me, or we've diagnosed that their fibromyalgia is caused by Lyme disease. So we'll check Lyme, and sure enough, they have titers, and we don't know when they obtained Lyme, but we might say that Lyme is correlated with fibromyalgia, okay? Knowing what I know now, I would say that an anti-inflammatory diet is in the best interest of anybody with any chronic trigger point, pain, or inflammation. So you want to choose the most anti-inflammatory diet. You want to avoid things that cause inflammation, especially with food when food is concerned. Now, there's other things that cause inflammation in our body, but that is a big one. Penny says, good morning from beautiful Central Florida. Thank you for being here. I appreciate it. Okay. T.A. Smith says, I'm guessing have had a respiratory gunk in my lungs since November. So that's 4 months. And all they say regarding chest x-ray is a slight thickening of the lower lobe of one lung. Thickening of a lower lobe of one of your lungs. So left lower lobe, right lower lobe. The most common area, I'm guessing it might be your right lower lobe, okay? The right lung has 3 lobes to it. The left lung has 2. Thickening, like an atelectasis, I'm not sure. And when you say gunk, does that mean you're chronically coughing? Are you having trouble breathing? Have you been to a lung specialist? That might be where you're headed. Could you have, I'm just asking, but could you have chronic reflux, and that is causing a problem with your lung gunk? Okay. Let's see. Anything over here? No. Original case says, I am beating lymphoma currently. Congratulations. I love that attitude. And some of the medicine given, prednisone, for example, seems to go against what needs to happen. I'm not questioning it, but some of it doesn't make sense. Well, that is a good clue to you, Original K, that you're starting to educate yourself and you're getting an uneasiness. And it's not, like you said, it's not like they're giving me wrong advice. It's just that it collides or clashes with stuff that you've been learning about what prednisone is, being a corticosteroid. And sometimes you have to weigh what is prednisone doing for me as far as my lymphoma is concerned, and can I snap back, once the prednisone is titrated to a lower dose, which you should be. If you're getting better, you want that prednisone to go down as low as possible and still give you symptom relief. And eventually, I think if you're not feeding the lymphoma and things are getting better, which, by the way, it's probably, I hate to say it's one of the better cancers to have, but it kind of is. Not as much of a death sentence, but it still could be. I'm not saying that it's not. But you have to, think about what they're treating and for how long. And sometimes they forget and you say, hey, doctor, I just wanted to remind you, I've been on this prednisone at this dose for 6 months. Shouldn't I, or 2 months or whatever it is, should I be weaning off? Just want your opinion. Should I try to go off? Oh, Deathhawk asks a good question. And some other people have been asking me this question about fluoroscopy, which is guided freezing cryoablation. So basically, I don't want to say it's a new technology, but it's maybe new and more up and coming, where they can go in through an ultrasound guided or a radiologically guided fluoroscopy procedure, where basically they can see inside your body much easier. They go in and see a tumor. So say a brain tumor or a whatever tumor, a nodule, a walled off area. They can go in, and what they do is freeze that. They'll just go, okay. Now, what I have read is that sometimes that tumor, or the purpose of freezing it, causes it to explode. That makes me nervous. That's kind of like poking a sleeping bear. But maybe they froze it so good that the parts that explode are not, have a potential to metastasize. I don't know. And that's what makes me kind of freak out a little bit. I don't know the answer, in other words, Hawk. I just don't know. But that breaking and exploding doesn't make me feel very good. Okay, how about that? I'm hoping that you freeze those tumors so much that there's no longer any activity for them. That's what I would hope. But it would be definitely, I would want to do my research. Okay, I don't think going in and doing biopsies on stuff is in our best interest, because I believe you're spreading tumor. Okay. Heather. Oh, thank you, Heather. You're very welcome. Thomas says, this is an awesome channel. Wow, I'm so happy to have found this. Please hit the subscribe button and the thumbs up. That would help. And share it. Share. If you hear something that you like and you want to share it with somebody, say, hey, listen in at minute number 22. I think this relates to you. All right? And ask questions. It's the best way to learn. Okay? All right. Absolutely, will do. Thank you, Thomas. Okay, here's a question in regards to dairy. About eating dairy on a carnivore diet. Do you like dairy? If you like dairy and you don't react to dairy, eat your dairy. Okay, I'm not one of those where, especially when it comes to, if you're eating an animal-based diet, you enjoy eating cheese and cottage cheese and drinking heavy cream. I think if you're tolerating it okay, then do it. But if you start complaining about rashes or joint aches and pains or weight gain, then you might need to reevaluate whether or not you want to put dairy in your body. Remember that dairy, like cottage cheese especially, and I bring this up because I eat some cottage cheese. Not a lot, but I like to eat some cottage cheese. But there are some people who cannot just eat some cottage cheese or drink some milk because of the casein, the type of casein. The casein in dairy, it's a type of protein, so there's whey and casein, proteins in dairy. Casein can be very addictive. The casein has something called casomorphins, and these trigger a receptor in our brain that is highly addictive. And so if you are a type of person that can eat not just one piece of cheese, but you have to have it till it's completely gone, you might not be a person that can tolerate cheese. Unless, of course, you don't mind gaining weight, having joint aches and pains, and rashes all over your body. If you say, well, you know what, I'm going to try A2 milk, which, a Jersey cow, A2 milk, it's raw. The chances of you having reactions are less. So choosing A2 over A1 would be better. Now, to get back to that question on leg cramps that somebody asked, remember that dairy raises calcium. And calcium is excitatory. So when you think of a muscle contraction, you think about calcium is excitatory and magnesium is calming. So in order for me to flex my bicep, calcium needs to be activated this is simplistic terms, okay? Calcium is excitatory, so it allows me to flex. Then the ability to relax, I need a compensation of magnesium, which is calming. Now, if you are eating too much cheese and dairy, heavy creams, cottage cheese, you could be increasing your calcium, which will deplete. My glasses are like twisted, you guys. The high calcium could be depleting your magnesium. And magnesium, like I mentioned before, is responsible for reabsorption of potassium. So if you lower magnesium, because calcium is high, that low magnesium is going to lead to low potassium. Now, sodium is going to dominate. And then if you eat more salt, you're really going to have more sodium. So you can see that your scenario is high calcium leads to low magnesium. Low magnesium is leading to low potassium, and low potassium could be associated with high sodium. And then you eat more sodium, which lowers the potassium, lowers the magnesium, increases the calcium. It is all of these things are wrapped up together, and we think that we could just our body's pretty good at finding equilibrium, but I think we do a lot of messing up things, okay, just by taking things here and there. So I think it's important that you know your body. Julissa says, does calcium build plaque in arteries? Calcium is in the plaque of our arteries. That's why we get a calcium score. A calcium score helps determine how much, I want to call it hardening, how much hardening of the debris. So let's start over. We have an artery, and inside the artery, we have lining. And that first lining on the very innermost part of an artery is the glycocalyx. It's a gel-like slippery layer that allows things to move through the artery and squirm its way through instead of penetrating that lining. So that glycocalyx is a nice smooth that allows red blood cells and white blood cells and all kinds of things that are traveling, even cholesterol in LDL particles, travel through there. If something damages the internal lining, that glycocalyx of the artery, the damage causes that glycocalyx not to be protective anymore. That could be sugar, insulin, heavy metals, nanoplastics, microplastics, smoking, all kinds of stuff that can damage that glycocalyx. Once that glycocalyx is damaged, now the injury can penetrate the endothelial lining, which is only one cell layer thick. And that endothelial layer, once there's an injury, things come like a Band-Aid, okay? And heal that injury. That's normal. Fibrin and red blood cells and white blood cells and platelets and all kinds of debris, even cholesterol or LDL particles, okay, can be in that Band-Aid, so to speak. And over time, that Band-Aid will harden. It'll calcify. Now, if what I'm hearing from you is, what if we take in too much calcium, or we take a calcium supplement Is this going to add to it? Great question. Do we know? No. Can we speculate? Yes. That why would anybody want to increase calcium when it is maybe has a potential to increase calcium in the plaquing? Great question, if that's what you were referring to. And I don't think anybody knows the answer, so don't let them tell you that. What I can say is make sure you even need calcium. I don't necessarily think that if you're eating some cheese here and there and you're drinking some, lay down, hold please. Tallow, lay down now. Tallow, lay down. Tallow, lay down. Thank you. Tallow's playing with the others. I apologize, but I just didn't want them to get me off track here. So my thought process is we don't know. And I don't think just simply eating a few pieces of cheese and drinking milk here and there or heavy cream is going to cause your calcium plaque. We need to get rid of whatever's causing the injury, because I believe that calcium plaque in our arteries can regress. They will tell you that it can't, and they will give you things that might, or they think will, reduce plaque in the artery. You guys, if you have a question and I'm not getting to it and you want to bring it to the top, just on YouTube especially, because I see a ton of questions that I may or may not get to, do a super chat and then you'll for sure get your question answered if I know the answer. But I want to capitalize on this calcium score and the calcium plaquing. What the worst case scenario would be is not all of that Band-Aid calcified. And we have an inner core that's soft. That inner core can break off. And that inner core is what leads to a heart attack or a brain attack, otherwise known as a stroke. That is my understanding, okay? I think the best thing you could do is for it to calcify. I mean, at least it stabilizes a soft plaque, all right? And the last thing we want is a soft, clot that could break off and cause problems. So the doctor putting people on a statin, is that causing plaque regression? I say no. In fact, studies have shown that statins increase plaque formation. They will increase your calcium score. Well, isn't that what the last thing I want to happen? Exactly. Now, I'm not telling you not to take statins or to take statins. Don't hear me say that. I'm just giving you what I think might be misunderstood. The benefit of a statin, if there is a benefit of a statin, it's this. Statins are anti-inflammatory. Anti-inflammatory. They are also anti-thrombotic. That means they're going to try to help with blood clot formation. And you think, that's a great thing. Right. I do think that. However, do we actually need a statin as an anti-inflammatory, or can we just get rid of whatever's causing the inflammation, i.e. sugar, insulin, smoking, alcohol, nanoplastics, heavy metals? See what I'm saying? Do we just naturally reach for a medication? Does the doctor just simply give up on us and say, you know what, it's your lost cause. You're probably never going to do anything. In fact, I don't even know what you need to do, but here's your statin. That's all I know. That's the guidelines. I'm following a recipe. You have this, here's your medicine. When there's really no talk. If you were to question a doctor about this statin, they said, you know what, do what you want. This is what I recommend. How do I know that doctors do it? I used to do it. If I was following guidelines and your LDL went above 140, I would suggest a statin. Why? Because it's guidelines and I follow guidelines. I follow the rules. I'm a rule follower. Doctor? Yeah, but doctor, doesn't it increase your plaque formation? Well, yeah, but it has shown in studies to decrease your risk of a heart attack. So let me hear you say this. You're telling me that it lowers my risk of having a heart attack, yet increases my calcium score. No, I did not say that. You said that. Well, it does, doctor, because I've read the studies on it. Were you aware? You know what? I just think that you're frustrated here, and I think that we're not seeing eye to eye, so maybe you should find another doctor. See how easy it is to dismiss you? Very easy. But if you know that statins can mess with glucose and increase your risk of diabetes, that statins can increase your calcified plaque, so plaque formation, your calcium score, it can increase your risk of dementia, although they'll tell you it decreases your risk of dementia because it's an anti-inflammatory. But what was causing your inflammation that was leading to your dementia, i.e. sugar and insulin? So again, these are questions that you really just need to ask yourself, but you have to educate yourself. And a lot of times we don't even know what questions to ask. And that's why you're on platforms like mine and you're asking all these questions, because you don't even know how to talk to your doctor about it. And I'm not your doctor. I'm just somebody giving you information on YouTube and Instagram on Sunday mornings at 10 a.m. Do I know all the answers? No. Do I want to guide you through all these things? No. I want you to take in the information and make good decisions and talk to your doctor about it. But I can be your doctor coach, right? And help coach you through things, help you write down things and have a plan. Okay? Okay. Yes, NRW, seed oils are another one. I did fail to mention that can injure the lining, your glycocalyx, and your endothelial lining. PUFAs, polyunsaturated fatty acids from seed oils, the big 8, the 3 C's, the 3 S's, rice bran and grapeseed, the corn, canola, cottonseed, sunflower, safflower, soy. Those are the biggest seed oils. And yes, I believe because they are polyunsaturated, they have multiple double bonds, which can get oxidized and cause damage to the internal lining of your arteries. So great point. Thank you for reminding me, NRW. I appreciate that. So, Jalissa, hopefully I answered your question in regards to that. Thank you. And if I didn't, let me know. In regards to the calcium scoring, does consuming dairy help reverse osteoporosis? Good question. But I think we get in our head that our bones are completely just calcium. And if we just improve our calcium, our bones would improve. Well, I'm here to tell you that 40 to 50% of your bones, so nearly half of your bones, are made up of protein. And so I believe a lot of people who have problems with osteopenia, low bone mass, and osteoporosis, complete high risk for fracture, is because their diet was not nutritionally sound with adequate amino acids and adequate essential fatty acids. And that protein, as well as lack of weight-bearing exercises, sitting too much, watching TV, eating bonbons, is a problem. But yet the doctor will tell you, just take some calcium. If you were to Google search or AI search, and using any AI, and you say, hey, I have osteoporosis, should I take calcium? The answer is yes. Okay, but I also heard that it can increase the plaque in my arteries. Yep, you heard right. AI should say. But it's a catch-22, and you have to weigh, do we have a heart attack or do we have a fracture? Because chances are, once you have one fracture, you'll have multiple fractures, and people die. If they're older, people die with the first fracture, like a femur fracture or a hip fracture. They don't live very much longer. That stress, it's tough, and especially for old people. So you gotta weigh all the pros and cons. Let's see. Jack says calcified plaque is less dangerous. I'm guessing you didn't finish it out. Say calcified plaque is less dangerous than a soft plaque. I'm guessing that's what, because calcified plaque is hard plaque, and a clot formation is from a soft core, which is soft plaque. And a calcium score only measures calcified hard plaque. It does not measure or give a risk of soft plaque. Could you have soft plaque underneath hard plaque? Absolutely. So in all reality, yeah, I guess you do want your plaque to harden and stabilize. Joseph says, I had a calcium score years ago at 57, it was 0. Joseph, that is a great score. And maybe, I don't know what years ago is, but maybe you get another baseline and you see if there's any progression. Maybe some people wait 2 years, some people wait 3 years. They tell you you can wait 5. I don't know if I would wait 5 years. I would want to know, hey, is what I'm doing right now, my exercise program, my diet regimen, what am I eating? How am I stressed? Am I retired? What's changed? And see what is that doing to the health of my arteries. Am I worsening things? Because if I had a baseline of 0 at age 57, maybe at 60, I want to recheck it and see what have I done in the meantime. Now, as we age, there could be, and more likely than not, you'll have some buildup of calcium plaquing just because the arteries are aging. But I think the more plaque we're going to get is, how much exposure are we having to, like what our NRW says, the seed oils, the sugar, insulin, heavy metals like iron, iron overload, graphene oxide, all of these things, nanoplastics, smoke, diesel fumes. I mean, I think I could go on, and you can't live in a bubble. I get it. You cannot live in a bubble. But there are some things that we can do to change. All right. So Joseph, you did good by getting that baseline. Okay. Jack says calcium goes up because the dangerous soft plaque becomes less dangerous. Yeah. You would hope that if that soft plaque, Jack, does not regress. See, we have normal things in our body. Let me give you an example, Jack. If I cut my hand, it's going to bleed, and then natural clot mechanism will take a hold, you hope, and it will stop the bleeding. It will form a scab, right? And then that will regress. That scab, now I got perfect skin. You can't even tell where I cut myself. That can happen in our arteries as well. If fibrinogen or fibrinolysis was working normally, lysis, breaking down fibrin. So breaking down what was used as a protective mechanism, resorbing it, and the artery heals. But can you imagine if you're smoking on a daily basis, eating sugar on a daily basis, breathing the air, drinking the water, you're in a big city smelling diesel fumes every day, you can see where that injury may not heal with our normal capabilities in our body. So you want to hope that that injury becomes calcified, stable. But you could see over time, I get an injury, I calcify. But finally, your one artery looks like this, okay? That takes years unless your exposure is, it just depends on how your body is making these things. So I don't think there's a one size fits all, but yeah, if I had to choose between a calcified plaque and a soft plaque, I would choose a calcified plaque because it's more stable. I'm in the United States. Slippery says, what about cholesterol? Why does the normal levels keep getting lower and lower and lower? Well, are they really? Okay, it seems, and this is just me thinking, cholesterol, they don't even talk about cholesterol anymore. Okay? They don't talk about cholesterol. They talk about what's carrying the cholesterol. LDL particles, IDL, intermediate density lipoproteins, very low density lipoproteins, VLDLs, HDLs, high density lipoproteins, small dense lipoproteins. It's the carriers of the cholesterol. So they'll tell you that, oh, normal cholesterol should be less than 200. And then they kind of leave it at that. What they're more concentrated on is, what is your LDL? And now people are smartening up and they say, doctor, I don't know if it's all LDL that's causing a problem. Maybe we should check an advanced lipid test and see what are my large LDLs and what are my small LDLs, because I've read that small, dense LDLs are worse than large, buoyant LDLs. And you might be right. You could possibly, likely be right, okay? So you ask your doctor and they say, no, we don't need that. Your LDL's high and this is what I think you should do. Take the medicine. Well, don't you think we should get an ApoB? Okay, we can get an ApoB because they've heard about that. And they know if your ApoB is high and your LDL is high, then you need to be on a statin and it'll strengthen their case. But you know, that would be the dumbest thing to get because, and I'm not saying dumbest thing to get, I'm just telling you, you know that ApoB rides along on every LDL. So even an intermediate density lipoprotein, an IDL, those are all LDLs. They're just sizes of LDLs. And so for every LDL, you have an ApoB. In fact, ApoB is on triglycerides. So if you have high LDL and high triglycerides, your ApoB is going to be sky high. And it should be less than, they'll say 130. Most doctors are going less than 100. So now you're in a conundrum. You got something that is almost strengthening their case when you know, or might know, that if my LDLs are all large and buoyant, the chances of me having heart disease is a lot less than if I had small, dense LDLs. So how do I lower small, dense LDLs? Lower carbohydrates. Why? Because eating carbohydrates, which raises sugar, which raises insulin, oxidizes LDLs and makes them dump out their inners and basically damages an LDL all the way down to a tiny little small, dense LDL. That's in simplistic terms, okay? I could go into the whole physiology and the biochemistry. I don't want to do that with you guys. I just want to give you kind of a sense that, hey, are we being told everything? And your doctor might not know everything. There's so much to know and there's so much unknown. That's what's crazy. I don't even know if I'm telling you the right answer. I'm just telling you what I know. I used to be the doctor who just looked at LDL and that was it. Your LDL's this, you get a statin. And if we can't get your LDL down to goal, I'm going to add more medicines to get you to goal. That was the recipe for you. So I don't know why cholesterol, the normal levels, and what is normal? I mean, do we really know what normal is? Is there like this kill switch in our body that says, oh, if you're total cholesterol, which by the way, you can't measure total cholesterol in your blood. When you get a cholesterol, you have to measure what is cholesterol inside of an LDL particle. LDLs carry, all particles, lipoproteins carry the cholesterol. It's not like floating freely in your blood and we can just get a level. But they'll tell you, your doctor might think that cholesterol's in your blood and I'm measuring it. No, it's measured inside the particles, okay? If there was a kill switch in our body that said the cholesterol over 200 and you're going to have a heart attack, then I guess a lot of people would be having heart attacks and they're not. Or we lower the cholesterol and get it less than 200 and people are still having heart attacks. I mean, it sounds like if you're using logic, if LDLs was the answer, then lowering LDLs down to 40, we would prevent all of these heart attacks, yet heart attacks are still occurring. Am I right? This is logical thinking. Why are they still occurring? Well, if you were to ask a doctor and they were honest with you and said, doctor, what is the number one cause of a heart attack or coronary artery disease? If they were truthful, they won't say LDL. What will they say? They should say diabetes. They should say elevated blood sugar. They don't even know why. Elevated blood sugar raises insulin. They don't know why those things are leading. And maybe I'm wrong. Maybe I'm wrong. Maybe they do know. Maybe they know that sugar and insulin are inflammatory and that an inflamed lining of your artery is not a good thing. Maybe they know that microplastics and nanoplastics cause inflammation and iron. Maybe they know that smoking plants and smelling diesel fumes increases your risk of having an injury to the lining. Maybe they know this stuff. Maybe they just don't have time to talk to you. Maybe they don't know any of what I just said, and they're just following an algorithm so they don't get sued. I don't know what the answer is, but you have to look through it, through the scope from both sides, okay? Hirsch or Atrish, I don't know what your name is, but I'm sorry to hear you have celiac. If you have a question, put it in the, you know what? I'm gonna have to, sometimes we have to put people in timeout since I don't have a, I do not have a moderator at the moment. Okay. So Jack, I think I answered your question. I'm just trying to go through these. You're asking if statins can cause plaques to stabilize. From what I know about statins, I can't get on board with that. Okay? Because if Jack gets a calcium score at age 50, and then at 55, they put him on a statin. So they get a calcium score and they say it's 50, okay? You have elevated cholesterol and LDL, so they put you on a statin. And then in 5 years, if the statin causes plaques to stabilize, then you went on your medicine, and that 50 should be 50 in 5 years as well. So it's 50 at the age of 50, and at age 55, it's still 50. Or maybe it's 55, which would be a normal progression of aging. But what if it's doubled or tripled? It went from 50 to 150. Well, is a statin stabilizing the plaque, or could it be worsening the plaque? Okay. Very good questions. Don't take no statins, says Babu. Yeah, and maybe that's the answer is don't, Babu. That reminds me, yeah. Hey, boo-boo. Okay, you definitely voted for Does it, John Jones? John Jones needs to maybe be a little timeout here. That's really too bad that you have to insert politics and people who really want to learn. So, Babu, change your diet and exercise. I would agree. There is a link between high cholesterol and type 2 diabetes. There is a link between triglycerides, high triglycerides and type 2 diabetes. There is a link between low HDL and type 2 diabetes, but you're telling me that the total cholesterol is linked to type 2 diabetes? Does that mean since the LDL could go up, which does all diabetes cause an increase in LDL? No, it might increase your small dense LDLs. And remember, while you're measuring high cholesterol, it means nothing, okay? Your cholesterol level means nothing. You want to know what particles are carrying your cholesterol to get them to get cholesterol to the areas that need it, like your brain. So I can't get on board with what Child of Perdition just said. Maybe they didn't mean what they said, and maybe they just needed to clarify it with me. Okay. Ruth says, to floss or not to floss? That is my question. Does flossing jam bacteria down into your gums? Well, I guess if you are jamming the floss into your gums, causing an injury, then bacteria can get into that injury. Gum health. I don't necessarily think that flossing was meant to jam it into our gums. I think it was meant to scrape against the sides of each tooth, like a C. So each tooth, you should be wrapping the floss around it like a C and going up and down along there. I don't think we jam it into the gums, causing an injury of the gums, okay? Because yeah, that could increase, bacteria into those areas. So I think it depends on, are we flossing correctly? Okay. And maybe you're a person that should not be using dental floss, but maybe using something like they're little rubber gum. They can actually go in between your teeth. And they have, I don't know what they're talking. They look like little probes. They're tiny little probes made by gum, Gum. They're little probes, and you can go back and forth, back and forth, back and forth, in and out. And they go to a narrow point, but when they're wide, they're a little wider with their little cleaners. I'm sorry, I don't know what they're called, but it's an option, another option for the flossing. And yeah, you're right. Flossing is plastic. So I don't necessarily think that we should be jamming the dental floss so deep into our gums that we're causing injury. Okay? Your teeth are so tight. So you got to find something else. Maybe you could benefit from the probes. And again, maybe you need to keep those gums healthy. Maybe you could do saltwater gargles. I don't necessarily want to promote antibacterial, but maybe for you, Ruth, maybe using a Listerine that is got zero alcohol, maybe that's in your best interest to help heal your gums. I mean, at this point, are we going to be so worried about the bacteria not making nitric oxide, or are we going to protect our gums so we prevent the bad bacteria? It's so such a double-edged sword, a catch-22. It's like, darned if we do, darned if we don't. And I think if you're going to floss, you just need to be easy on your gums, okay? Jack says, my diastolic blood pressure is low. Is that a warning? Blood pressure is 98/42. Are you on a blood pressure medicine, Jack? Oh, childhood perdition has been on a statin for 25 years. Good. I mean, I hope it's working for you. It's doing everything that it needs to do for you. Let's see. I'm looking for questions here. So Ruth, when you go to the dentist, Ruth says her gums are healthy. When you go to the dentist, do they measure along the side like 1 through 5? And when you say your gums are healthy, are you just getting some 1s and 2s and not 3, 4s, and 5s? That's important that when they're measuring the health of your gums, is that you have no 5s, 4s, or 3s. You want 1s and 2s. So make sure you're listening and asking them about that. Smoke Gun Pata says, I eat 22 whole eggs and a half a kilo, so about 1.1 pounds of chicken every day. Cholesterol is overrated. Okay. Childhood Perdition says, mine, I don't know what mine is. Mine was 267. Are we talking about cholesterol? And triglycerides were 428. So whoever is listening and knows anything about triglycerides, what would you call childhood perdition right now? Would you call this person diabetic? Would you call them insulin resistant? Having a triglyceride, that is free fatty acids floating around in your bloodstream, basically. So if I were to take this person's blood and then I spin it down, the test tube that it came in will look like milk with that many triglycerides in there. Do you think that's healthy? No. What raises triglycerides? Carbohydrates. Carbohydrates raise sugar. Sugar raises insulin. This person's probably a diabetic, okay? And diabetes is glucose, carbohydrate toxicity. You're welcome, Slippery. Synthetic processed white sugar is not real sugar from fruit. Oh boy. All right. Glucose is glucose. All right. And there's glucose and fructose in fruit. So you're telling me that the chemical formula is going to change. So the glucose and the fructose from fruit is not going to cause diabetes like the sugar that's synthetic in your crapola food. Is that what you're telling me, that if you eat this similar load of crapola food with synthetic sugar, your processed sugar, cleaned up, bleached, whatever, that basically it's cane sugar, which comes from a plant. You took it from a plant, you cleaned it up and bleached it, and you're telling me that that's worse than the exact same amount of glucose in your fruit, as if your body says, ooh, this sugar coming out of fruit, it's okay, I'm not going to get diabetes. And that sugar coming from processing is going to cause my diabetes. Good luck with that, okay? Just good luck with that thought process. Does fluoride control the mind? How about fluoride as a neurotoxin in high doses? Does that answer your question? Thank you, Jack. I appreciate your compliment. That means a lot to me. Right, James, I agree. If statins were the magic pills, heart disease would plummet, and it doesn't. Why, James? And you know the answer to this, because diabetes is worse. The number one cause of cardiovascular disease is diabetes. But Jack is saying that heart disease has declined. Is it heart disease has declined, or heart attacks killing people has declined? I would agree with the latter. Why? Because healthcare has gotten better in saving your life, but not preventing the heart disease. So heart disease has not declined. Heart disease is going up. The fact that you're dying from a heart attack has declined. Would you agree with me, Jack? Okay. Babu says, brush your teeth thoroughly and do oil pulling with unrefined coconut oil every night. Also brush your tongue every night. That was to Ruth, I'm guessing. A water pick is also, or a toothpick is also a good answer. Yes, I would agree. Just don't get the toothpick, the wood trapped in your teeth, and that is going to be a bummer to get that out. OS, and who, Dr. Iron Lady, you're the best. What's your thoughts on eggs increasing cholesterol, myth or not? Well, eggs have cholesterol in them. If we eat cholesterol products, our LDL is going to go up in order to carry the cholesterol and fat that we're increasing in our diet. So yes, eggs could raise cholesterol, but then that shuts off the switch in your liver to tell you not to make cholesterol. So it could be an even Steven kind of a deal. And you're getting everything that's bioavailable and nutritiously complete by eating egg yolks. Egg yolks. Okay. Rochelle says, can I throw my blood? No one wants it in donation. Yeah, you can just ask to dump your blood. That would be, I mean, people do it all the time. They go and dump blood every 3 months. Medusa or Med USA, I don't know which one it is. You are motivating me to learn more, and for that, thank you, madame. You're very welcome. I'm glad to help. Specific fruits, as in which, with real sugar. So, we get to this concept. I am assuming that Babu thinks that the fruit of today is actually real and not also man-made. I would wholly disagree with that assumption, because our fruit is genetically modified to be bigger, fluffier, and more sugary to intoxicate and seduce you into eating more. Okay? So until you get that into your head that there's no real sugar. Sugar is sugar. Glucose is glucose. There's glucose, fructose, lactose. There's all kinds of sugars, you guys. But fructose and glucose and sucrose, which is table sugar, you're telling just because they put it into some processing machine that it's going to do something totally different in your body than if you consume fake fruit made in a lab with a seed from a global flavorist. We're bamboozled. This is my key line, you guys. There are so many people who are bamboozled by the buffoonery that they have a condition called ignorosis. Osis means a condition of ignorance. And it's because we've been bamboozled. We want to believe something over here, but because we've been told over here that that's not true, that's called cognitive dissonance. I was there. I said, how can you be telling me this when I know that this is what the answer is? When this really wasn't the answer, it's what they fed to me for 40 years. It was being fed subconsciously through the radio, through the TV, through the doctor, through the whatever it is. That and this are fighting. And that, my friends, is called cognitive dissonance. And that what leads to being bamboozled by the buffoonery, by the information they give us on a daily basis. You don't even know what's true or not. I'm telling you something that doesn't align with your thought process, like Babu. He or she is hell-bent on saying, that fruit sugar with fructose and glucose, that's totally okay. Versus this sugar shaker that I do cinnamon and sugar toast. That's got to be different. That the fruit sugar absolutely does not cause diabetes. Really. That's called cognitive dissonance, you guys. All right? MedUSA, thank you again. For the fluoride and dental paste, do you suggest something better than usual toothpaste? Here's what I want you to learn about fluoride. The reason they put fluoride in water. Why? Why would governments put fluoride in water? There's one reason that they would put fluoride in your water, and that is dental caries. Dental caries are cavities. If they put an antibacterial fluoride in the water, it helps to prevent dental caries. Does it? No. What is causing the dental caries? Is the dental caries from a lack of fluoride, or is it from something else? It's from sugar. Sugar causes cavities. So I'm going to be the government and put fluoride in your water so I can get you to continue eating the crapola so you can get the cavities to make a big bucks for the dentist. So if I don't put fluoride in your water, the dentists are going to have a heyday in all reality, okay? Now, if you're going to eat sugar, I think you need fluoride. If you're going to eat carbohydrates, I think you need fluoride. Because you're not going to stop what's causing the bacteria growth. And fluoride is the antibacterial. The problem with the fluoride in our water is, are they really keeping track of how much they're putting in there? Because at this dose, it's neurotoxic, causing brain damage. And at this dose, it acts like an antibacterial. So from here to here, you know, how do we know what's doing to our brain? And so some governments would say, we're not going to put fluoride in the water anymore. So you go to these little towns in Tennessee and they say, nope, we're not putting fluoride in our water anymore. If you want to avoid getting the cavities, stop eating the sugar. If you want to stop the cavities, take your own fluoride. Buy the toothpaste, do the thing, but the government, we're not going to put fluoride in our water anymore because we don't want to be at risk for causing brain damage in people as a neurotoxin. So if you choose not to put fluoride in your toothpaste or your water or whatever it is, then you have to be okay with, I could have a possibility of having a dental carie, a cavity. Yeah, but I'm going to really stop the sugar too. Really stop it, or are you going to stop it? It's in everything. So keeping your mouth clean and trying to prevent dental caries, so bad bacteria from growing, is in your best interest. Are we going to rely on fluoride? Fluoride's obviously not working because dentists are still in business, right? Okay. Hello, doctor. I'm in London. You are saying that fructose is as much harmful as synthetic sugar. In its own way, fructose is very harmful. It isn't even metabolized the same as glucose. You see, fructose goes directly to the liver. There isn't a step of glucose processing. So glucose has to go through a process to break it down and use it. Whereas fructose goes directly to the liver, and the liver tries to process it. If there's too much fructose coming in, because it's in everything, not just fruit, the liver stores it. The liver is choking out with as much fructose as going on. Also, fructose raises uric acid levels. And if you want to check how much fructose you are consuming, get a uric acid level. Now, one thing to mention to you, is fructose going to raise your insulin level? Yes or no? Does fructose increase insulin? Fructose is a sugar. Does that particular sugar, fructose, raise insulin? Is it going to cause an insulin spike? So you've answered that in your head, and the answer is likely not. No. Does fructose raise your hemoglobin A1C, your diabetic marker? Answer that in your head. Does fructose raise your A1C, your hemoglobin A1C? The answer is no. The hemoglobin A1C is a measure of glycated glucose, not glycated fructose, not glycated lactose, not glycated galactose, glycated glucose only. You're only measuring hemoglobin A1C. You're measuring glycated. When a sugar binds to a protein like hemoglobin, we get an answer called glycated hemoglobin. And we are so, as doctors, glucose-centric that we make diagnoses of diabetes by blood sugar. If you have high blood sugar, you have diabetes. If we measure how much blood sugar you have over 3 months by measuring glycated hemoglobin A1C. Got it? So hemoglobin A1C does not measure fructose. So you could be eating a bunch of fructose, causing fatty liver and diabetes and not know it, because you've been told your A1C was in the normal level, optimal level. It's less than 6. Less than 6 is less than 126 blood sugar. You don't have diabetes. But we never measured your insulin level. And your insulin level will tell a story long before your glucose is telling a story that you're diabetic. So again, you guys have to choose. If you want to eat fruit, small fruit, large fruit, less sugary fruit, that is up to you. I'm not going to tell you what to do, but you should know what fructose and glucose in combination does to your body. anytime glucose, sugar, is going up in your body, remember, fruit is maybe 60% fructose and 40%, or maybe let's just say 50-50 in today's society. It's 50% glucose and it's 50% fructose. So that glucose is spiking and glycating. And if you're okay with oxidation in your body, and if you're okay with wrinkles on your skin, then continue to eat the fructose glucose combination in whatever fancy fruit you want to eat. These are just decisions you can make. Nobody's telling you not to eat sugar or fructose or fruit or high fructose corn syrup. Nobody's telling you any of that. Thank you, MedUSA. I appreciate that. Right, DJ. As type 1, your body doesn't know if you ate a banana or a candy bar. I agree to some extent that, although remember that your fructose isn't going to cause an insulin spike or a need, in your case, in a type 1, for more insulin. I believe if you completely ate fructose, it is not going to spike your blood sugar level enough that you'll have to take more insulin. I know it sounds funny to say that, but as a type 1, it's a little bit different scenario compared to a type 2. A type 2 has too much insulin. A type 1 doesn't have any insulin. So if DJ is going to eat a piece of fruit or eat a pastry, the blood sugar is going to go up, and DJ has to treat that with insulin, okay? The more sugar that person puts into their body, no matter what kind of sugar, they're going to need insulin to take care of it, or they're going to die. They cannot live without insulin. We cannot live without insulin. We would die. We're just getting way too much insulin. And a type 1 diabetic can get way too much insulin. Makes sense? If you continue to eat the way you are, you're going to need insulin, and insulin is going to cause coronary artery disease. It's going to increase your risk of coronary artery disease by causing an injury to the internal lining of the artery. So DJ, being a type 1, wants to keep their dosing of insulin as low as possible to avoid the risk of coronary artery disease. Whereas a type 2 is just thinking all about their blood sugar and all about, well, I don't need to change anything as long as I take my metformin and my SGLT2, my Jardiance, and take my Ozempic and take all the medications. I can eat whatever I want as long as I just push it into the cell. Well, that's kind of a weird way of thinking about it, because if glucose is high, it's high everywhere. So if it's causing damage in your bloodstream, wouldn't it be causing damage inside the cell as well? You're just going to stuff it from one pocket to the next pocket? It's still causing problem. It's too much. There's too much. There's too much glucose. If it's in your bloodstream poisoning you, you're just going to take a medicine and stuff it inside a cell? Like stuff it inside of a fat cell? Stuff it inside of a muscle cell? At some point, the fat cell's going to get so fat, he's going to explode. He's inflammatory already. He's going to explode all of his inner contents, which then cause more inflammation and more damage, and on and on and on. And then, the little organelles, they're getting toxic inside the cell. The mitochondria can't deal with all that sugar. It just can't. It only is used to dealing with 5 grams in our blood at any one time, 5 grams. We eat a piece of bread and we get 20 or 30 grams. And our mitochondria only are really good at dealing with 5 grams. If you're an average size adult with 5 liters of blood, you have about a teaspoon of blood sugar. But since we constantly eat all of the luxurious foods that, people will tell me, I'm gonna go exercise today. Well, why? Well, it's not because I want to get strong muscles and build endurance for my heart. It's because I want to keep eating whatever I eat. Oh boy, that's a conversation I want to exit right now, because I don't even want to get into it with that person. You do you, and if you want to have mitochondria being destroyed and increase your risk of cancers, remember insulin. Insulin grows cells. It's a growth type of hormone. So yeah, you're growing fat cells and you could be growing muscle cells, but you're also growing tumor cells. And I say, I'm going to keep my chances of growing my cells to the least damaging, okay? I don't want fat cells. I especially don't want a few amount of fat cells. They're very damaging. I would rather have 100,000 fat cells than 100 big, giant fat cells, okay? My chances of survival with less chronic disease with many fat cells is better than having a few giant fat cells, okay? Jack says, I'm not on blood pressure medicine, but I do drink ginger juice. Is it possible that I could be skewing my diastolic pressure to be in the 40s? No, no. You just have to be conscientious. If you, Jack, are dizzy, every time you lay down, sit up, you get dizzy. And then when you stand up, you get dizzy. Then your pressure is likely too low because you're having symptoms. And if you want to increase your blood pressure, you could just increase your mineral salts. You could take in more electrolytes, more salt, good salt, natural salt, okay? I don't know if your ginger juice is lowering your blood pressure that much. What would be the mechanism? I don't know, I'm asking you. What is the mechanism of ginger juice lowering your blood pressure? Does ginger increase nitric oxide? I'm not sure. I really don't know. I'd have to look it up. Because nitric oxide vasodilates, right? Okay. Now, the definition, just as a reminder of starved, the definition of starvation is actually having no fat on your body to break down fatty acids and make ketones. If you are completely out of fat on your body, then you can go into starvation and you can use the word starved. But until then, you are hungry, meaning you lack nutrition. When you are hungry and continuously hungry, that's your body telling you that you are nutritionally depleted. Okay? You're malnourished. You're not starved. Starvation is having no fat on the body and an inability to make ketones from fatty acids because you have no fat on your body. And we rarely see that in America. And if you're in America and you're using the word starved, you're saying, I'm just hungry. So if it wasn't for modified food, I would be hungry. That's not starved. You're hungry because you're malnourished, because you're eating fake food. So if it's not as bad as what you want it to make it out to be, keep eating it. Just keep eating it. It's up to you. We're not, so you want me to talk about buzzwords? That's fine. You can look at it as a buzzword. I would agree, Eddie. I would agree with Eddie's comment. There's a way to make money. We're going to make it. We're going to modify everything. That's I'm not addressing the issue. I love to be gaslit. I love to be gaslit. It's a wonderful feeling. Yeah, Jack, I would agree with confirmation bias. Thank you, Keith. I appreciate that. Okay. Smasher, the sugar feeds the bacteria that causes your cavities. But thank you for the clarification. I appreciate that. Okay, so we let, some people have a say, but when they want to start being derogatory, then we have to put them to bed. Hi from Australia, been on HRT for 2 years, helps with hot flashes. Are bioidentical creams better? Tired of stopping, but tried to stop, but the flushes are intense. I eat carnivore with only cheese, avocado, thanks. I mean, that's a decision for you to make. Bioidentical hormones are still synthetic. They're still made from plants. Those bioidentical creams are made from phytosterols. Okay? That means plant cholesterol. Not really cholesterol, plant sterols, where we make our hormones from cholesterol, animal cholesterol. So you are still taking in a synthetic type of hormone. And at first, maybe 2 years, you might be getting benefit from it. You'll feel better because your own hormones are down for whatever reason. Okay, as we age, we're postmenopausal, your estrogen is going to be lower. So it's a decision that you have to make. Everybody has their own ideas, but no, you're not taking anything that's natural. If you're thinking bioidentical means natural, it's not. It's made from plant sterols, not from cholesterol. When we eat animal fats and cholesterol, we will make pregnant, can tell the adrenal glands to release DHEA, and DHEA can convert to androstenedione, and androstenedione can convert to testosterone, and testosterone can convert to estrogens, okay? That would entail that you're actually taking in animal products with cholesterol, and it has to ensure that your adrenal glands are functioning and not stressed out. So you're kind of relying on a whole bunch of stuff. If you find that I'm no good without my bioidentical creams, maybe you could do a lower dose. I don't know. Maybe you just use the minimum dose. Yeah, Bonnie is adding to the fluoride conversation. Bonnie says that fluoride should be topical, and that would mean toothpaste, so to speak, but we're still ingesting it. Even though, you know, the mucous membranes are still, fluoride will still go through the mucous membranes. Too much fluoride, Bonnie says, causes intrinsic stain in the enamel. So the staining of the enamel, that's why they put whiteners now in our toothpaste. And she says fluoride damages the pineal gland. I would add that fluoride also damages our thyroid gland. The fact that we have fluoride, a halide, so fluoride, bromide, chloride, and iodine are halides on the periodic table. When fluoride is so high, it can go lay down. When fluoride is high, when bromide is high, when chloride is high, it blocks iodine from the receptors of our cells, and all of our cells need iodine, and especially our thyroid gland. So we cannot convert T4 to active T3 without iodine. Okay? Go lay down. Okay. Mycotroph says, does fiber in fruit make the impact on blood sugar less acute? Yes. Thank you, Gio. Thank you for being here. Ashley is listening from Texas. Thank you. P.S. You are amazing. I'm a nurse and need you at my work. Oh gosh, I left for a reason. There was way too much trauma to my body and brain and heart. And so going and doing this has caused more delight in the last year, not quite a year, than I've had in years. Being a doctor and knowing things that I know is like, it's very, very stressful, and I could never go back to that. I could never work for anybody, and I don't think I can work on my own unless it was doing what I'm doing right now and working just for cash and not the insurance companies. But with that being said, I really enjoy doing this type of informative discussing back and forth, although I'm trying not to be derogatory toward you, and I hope that you won't be derogatory toward me. We can have a conversation. But when we start calling each other names or using our credentials, which is an ad hominem fallacy, logical fallacy called ad hominem, that you're basically just trying to destroy my character. And I'm not dealing with that part. Okay. And I know SMC, you're not doing that. I'm just talking out loud here, but I appreciate the compliment. That means a lot. Thanks, doctor. Me and the wife are trying to conceive. No luck. Been 8 months. Both got tested. Results came back normal. Any advice? Have you tried a carnivore diet? Have you tried increasing your fat? Have you tried not trying so hard? Lowering your stress, getting outside, standing barefoot on the ground, just doing things naturally. But it's usually stemming, I would say, from a diet. Okay. Let's make sure I don't have anybody else. I am engaging with the chat. It's just that I can't keep up. So if you have a question and you want it answered now, do a super chat. It helps us both. You get your question answered faster, and I get $1. Friendly asks, what will help with big bowel movements? Having food that you can't process. If you cannot process your food, you will have it called waste. So basically what you put in your body and the waste that comes out means that you didn't use it. If you have smaller bowel movements, you used a lot of that nutritionally dense food. If you didn't use it, you will have large amounts of waste coming out that your body couldn't use, and nor could the bacteria. DEA says, or no, Def Hustle says, is coffee good for you? I guess it depends on who you ask. You'll have some cardiologists that will tell you that the coffee is good for your heart, and you'll talk to some other people and they'll say coffee's a plant, and plants have oxalates and phytates and tannins and saponins and all of these anti-nutrients, and you shouldn't drink coffee. So I guess it just depends on who you ask. Ginger reduces inflammation, which can be, okay, so if ginger is used, could it lower the inflammation enough and lower blood pressure? Yeah, it's possible, right, sweetie? So ginger could be lowering Jack's blood pressure. Babu says coffee's not good for you. So if you're asking Babu if coffee is good for you, then Babu says no, coffee is not good for you. Okay. Def says, interesting, I'm trying to wean off of coffee, but my type of job needs me to stay up. Like 24 hours? Or are you not sleeping when you should be sleeping? Thank you, Bonnie. I appreciate the gift. That means a lot. I guess you're trying to stay up. Does that, I mean, I don't know if you're a shift worker. I don't know what your job status is, but that tells me that you're not sleeping when you're supposed to be sleeping. Oh, I didn't know that, Parasite. Thanks for letting me know. Parasite Zappers says amalgam fillings are outlawed in Europe. I didn't know that. Thank you. Sweet and Kind says, what are your thoughts on iron infusion? I wonder if you have any information on this. I'm anemic. Why are you anemic? And what is the definition of anemic? Okay. An iron infusion is synthetic iron going into your body. Okay. Synthetic iron is non-heme iron. Non-heme iron is 3%, about 3% absorbable, whereas heme iron is about 30% absorbable. So you're basically putting you have to put so much more non-heme iron in your body. So you're going to infuse a large amount to just try to absorb the amount that you need, which it's only 3% absorbable. So you can imagine how much more infused iron you're going to need compared to a ribeye steak of heme iron. And we can get into a situation where we get iron trapping in organs. Iron oxidizes in our body. We need iron for every process that goes on in our body, but we get so much of it through our processed food diet. Non-heme iron is in everything that's processed, okay? So you're consuming large amounts of non-heme iron. So what you think might be anemia, which means I have low hemoglobin, I have low iron. Did you get an iron level? Did you get a ferritin level? Did you get a transferrin level? Did you get a TIBC? Did you get a saturation level? Did you get a hepcidin level? Did you get a copper level? Did you get a vitamin A level? What if all of your iron is stuck inside your cells, in your organs, in the tissue, and it looks like you're low in your bloodstream? And then you are told to, well, let's just go take an iron infusion. And now you just made your symptoms even worse. Right? I mean, you don't know. Oh my gosh, Dr. Jensen, you just confused me. I didn't mean to confuse you. I'm just telling you that some of the things that you're being told wasn't the full truth, the whole truth, and nothing but the truth, okay? They didn't look into everything, I'm guessing. So if you have high hepcidin levels, you're going to get iron trapping, okay? If your vitamin D level is low and you start taking a whole bunch of vitamin D, what is that going to do to vitamin A? What is it going to do if vitamin A is at a certain level? What is that going to do to copper? If copper is low and vitamin A is low and vitamin D is high, because I took a whole bunch, you're causing iron to be trapped in your liver. Low copper causes iron trapping, which raises hepcidin, which causes iron trapping. What's iron trapping? Well, if hepcidin is high, then ferroportin is low. And if you don't have ferroportin, you have no transport from the inside of the cell to the outside of the cell. Ferroportin is like an elevator that takes iron from inside and dumps it outside. So we got a lot of problems going on when we don't have a lot of information. And really, it's hard for me to walk you through all those things. And a lot of times that's where a consultation comes in, where, you can get personalized information and we go through all of your labs together, okay? Okay, thanks, Parasite Zappers. If you guys are in California, you can get your raw organic milk from Strauss Family Farms. Good morning, 1910. Thank you for being here. Okay, hopefully I answered your question, Osan, on Instagram. Yeah, Bonnie, yay for Europe banning amalgam. That's awesome. I don't know why it's not banned in the United States. I don't know much about dentistry. So Babu says you need to start eating more leafy greens. Well, all plants have non-heme iron. So what's the difference between eating more leafy greens and taking an infusion, Babu? There's nothing. They're both non-heme iron, which then you get into the exact same scenario that I just got done talking to you about. So I know it sounds like a wonderful thing is just eat some leafy greens, eat more non-heme iron so it can get all trapped into our organs. Yeah. Oh, thank you, 1910. Yeah, there looks like there's 50 people on live stream right now. Have you checked and are you subscribed? Show me some support is what 1910 is saying. Hit the thumbs up, hit the subscribe, share it, do all that. Thank you. Anything over here on Instagram? You guys, thank you over there on Instagram for being so gentle. Hummus says you don't need heme iron. You just need iron. Okay. Hummus is the guru on iron, you guys. Bonnie says she uses found Tom's fluoride free at Costco. I think you could probably find a whole bunch of fluoride free toothpaste on Amazon as well. Sweet and Kind would basically saying, you've given me more information than my hematologist would Detox, untrap the iron. Yes. Yes. I don't even know who I would listen to. There's people on YouTube who talk about detoxification with, please do not quote me on this, things like MSM, DMSA, wormwood, things like that people are using to detoxify heavy metals of all kinds, okay? Iron being one of them. So yes, I think it's possible that we can untrap our iron, okay? It is, Geo, thank you, and I hope yours is going as well. Thank you, Jack, for being here. I appreciate it. Okay, you guys, are there any other questions? We've been kind of rolling through some of these questions, getting an idea of where, that is true, Hummus. That's very true. But if you are taking in all of this vitamin C, so what I would call is a triad that we have been talked to about during viral infections is increased C, increased D, increased zinc. All of those things iron to be driven into the liver. So you can eat your green leafy vegetables with non-heme iron, increase your vitamin C for the absorption to get like a heme iron, okay? Because heme iron is 30% absorbed. You don't need very much vitamin C at all. But yeah, you could be causing even more damage by eating your leafy green vegetables full of oxalates, phytates, saponins, tannins, protease inhibitors. You could be doing all of that. And all of those plants also have fiber, and fiber blocks the absorption of iron. And so do oxalates and phytates. So you can take all the vitamin C you want to try to increase the absorption of non-heme iron. And you can take all the D you want, and you can lower your vitamin A. Oh, and you can just eat some sardines, but you don't eat sardines if you're eating a whole bunch of green leafy vegetables because you're going to be full. So, it's up to you. But telling people to take in all this vitamin C and this non-heme iron from green leafy vegetables is causing a lot of other problems, okay? It is what it is. So I guess if you want to avoid the oxalates and the phytates and the saponins and the tannins and the protease inhibitors and all those things, I would boil the green leafy vegetables and not eat them raw. How long do you boil them? I'd say about 20 minutes boiling them. That should get most of the oxalates, the phytates, the tannins, saponins, and protease inhibitors out of there, and maybe even degrade the fiber a little bit. That's a possibility. You could do all of that, and I would recommend that if that's what you want to do. Okay. Brian says, a big steak sounds easier. Explain vegan Olympic athletes. I don't know any vegan Olympic athletes. Maybe you can help us to explain a vegan athlete. James says, non-heme iron versus heme iron are extremely different in bioavailability. That's exactly right. 3% versus 30%. Thanks for the clarification and absorption rates. You're very welcome, James. Thank you. What do sardines do? Sardines have excellent amounts of omega-3. They're high in vitamin D and high in vitamin A. Okay. Baboo, Irish sea moss. For which? You take an Irish sea moss for? Omegas or what? Tell me. We didn't just move right past. Sometimes I can't see all these, there's a lot of comments in here and I'm trying to get to the question mark. So if Baboo has a question, put a question mark into it instead of, that's rude. This is one person. I am a team of one. I don't have anybody helping me read through the thousands of questions that likely are coming through that I can't keep up with. So I apologize, Baboo, if you felt slighted in any way. So do the Instagrammers, and so do everybody else who has me answer a question. So poor Baboo. Okay. Thank you, Angel. I appreciate that. Yep. Thank you, James. I appreciate that. Bonnie says a big steak sounds easier. It does. It does. Okay. Babu, I'm not here to fight with you. Well, I'm here to have a discussion. But if you want to have a fight, then I would suggest that you go somewhere else and have a fight. I'm not going to do it. Hummus says there are many athletes, he named some or she named some, and they said high level strength and endurance can be achieved without animal products. Excellent. I'm happy to hear that. That's excellent. You're very welcome, Cold Peace. I appreciate that. What causes irregular periods? I mean, there's a number of things that can cause irregular periods. Doctors say iron deficiency can cause it. Okay. 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 That's why, Babu, if you have a question, I'll be right there, buddy. That's my toddler. He's got to go to the bathroom. So I'm going to call it quits on this. But for Babu and everybody else, if there's so many questions and you want to raise your question higher on the list, just do a super chat. I would appreciate it. All right, you guys, we will call it quits, and we will be back next Saturday at 9 a.m. Central. You're very welcome, Angel. We'll be back next Saturday at 9 a.m. Central, Lord willing, and Sunday at 10 a.m. Central. So catch my reels, hit the subscribe. If you want to sign up for a consultation, email me at IronLadyDoc, IronLadyDoc at AOL.com. So email me if you want a list of labs. I can send you a list of labs. Email me if you want to sign up for a consultation. And otherwise, check out the reels on a daily basis. They're for educational purposes only, not meant for medical advice. So you guys have a most wonderful Sunday, a blessed Sunday. See ya.